Welcome to OOD Works, the podcast, a show about unique individuals and the services provided by Opportunities for Ohioans with Disabilities, the state agency that helps individuals with disabilities find a job and be more independent. Here's your host, Kim Jump.
On this episode of OOD Works, I'm joined once again by OOD Director Kevin Miller and Maria Seaman. She is OOD's Chief Financial Officer. She's been with the agency since June of 2011 and was the agency's budget manager for over 7 years. And she began her career in state government in 1997, working for the Legislative Service Commission's fellowship program. And she remained on staff there for nearly 14 years, where she covered primarily health and human services agencies and legislation. She's been our Chief Financial Officer now. Has it been for 3 years, Maria?
Just about 2.
2 years. And she has a Bachelor's of Arts in International Studies degree from the University at Buffalo and a Master of Public Administration degree from North Carolina State University. And so Maria and Director Miller are here today to discuss the proposed biennial executive budget that was announced in early February 2021 by Ohio Governor Mike DeWine, and it lays out the plan for the fiscal years 2022 and 2023 budget. So welcome to the podcast, Maria and Director Miller.
Well, 2 things. One, you don't ever introduce me as good as you just introduced Maria. And number 2, that's just a reflection of my great leadership that I hired someone like Maria. See, so.
Yes, thank you, Director.
I feel like our listening audience tends to know you pretty well, Director, but I don't think they often get to hear from folks kind of in the service areas, support areas behind the scenes, like Maria and her staff. So I think it's great that you could join us today.
I'm gonna go over here and sit in the corner while you guys have a conversation. I think it's important that, number one, people understand what we have to do to get the funding that we get and what we can deliver on, and then be able to tell a story that's backed up by data and third-party entities. And so Maria has navigated that extremely well, and I'm glad she could join us today.
Yeah, me too. Well, we're definitely going to dive into the governor's proposed budget for OOD and how it allocates sustained funding that we do have to see if, I should say, the Ohio Legislature keeps that proposed budget intact. So we'll talk about what it would help us to be able to do. But I thought it would be awesome, Maria, if you would give an explanation of how OOD is funded.
Sure. Thanks for having me, Kim and Director Miller. It's always good to be with you to talk about the budget. OOD's funding is really a partnership between the state and the federal government. So we receive a combination of general revenue funds, some other state non-GRF funds, and then federal grant funds that support the agency's program and expenses. So general revenue funds, when we think about them, they really come from state taxes like sales tax and income tax. But our agency also receives some other, what we call state non-GRF funds that come from a specific source. So it's not taxes, but rather it's from some other source. So for example, OOD receives funds from the DUI license reinstatement fee, which is, I think, kind of an interesting fact about the agency. Not a lot of people realize where that we are a recipient of that source of funding. So when someone has lost their license due to driving under the influence, and when the time comes for them to get their license back, they have to pay a fee of $475, and OOD receives $75 of that fee. So we used to receive as much as $3.5 million per year from that source alone. But we've seen the source of revenue decline a bit over the last decade, but in fact, even more so in state fiscal year 2021. That source of revenue for us has actually been cut almost in half. Most likely due to the pandemic, with the courts being shut down for a time. We don't think we've yet felt the impact of on that particular source due to the pandemic of perhaps fewer DUIs in general with the closure of bars and restaurants and maybe fewer social gatherings since Ohio's license suspension for DUI is anywhere from 1 to 3 years. So we probably haven't yet, felt the full impact of the pandemic on that source of funding, but we're certainly expecting that to go down even further. Our other state non-GRF funds include transfers that we receive from other state agencies and local governments for partnership agreements that we have with them. And then, of course, we receive service charge that's paid to us by our business enterprise operators. The majority of our state GRF and non-GRF funds are used to match the federal grants, primarily for vocational rehabilitation and then some smaller independent living grants. We also receive federal funds from the Social Security Administration for operating our Division of Disability Determination. So if you look at the breakdown of our funding by source, our federal funds make up about 83% of our total funding. Our state GRF make up another 7%, and then the remaining 10% comes from those state non-GRF funds. So then if you look on the expenditure side, our VR program and Division of Disability Determination together make up 90% of our total funding for the agency.
It's helpful to know that. And could you explain the match that OOD is able to draw down by state dollars and then what that means in terms of a federal match?
Sure. So our federal vocational rehabilitation grant, as well as our independent living grants, require a state contribution to that. So it's almost a cost sharing arrangement between the federal funds and the state funds. The vocational rehabilitation program requires a $1 state match to draw down $3.69 of the federal vocational rehabilitation grant allotment that is set aside for Ohio. Our independent living grant funds, which are much, much smaller than VR, is a 1 to 9. So for every dollar we spend, we can draw down $9 up to the state's allocation.
Gotcha. And you had mentioned, like with the change with the DUI funding stream, for example. So a lot of this is forecasting, and like how challenging is that for the Division of Finance to kind of be looking so far ahead in terms of figuring out what OOD is going to need for current initiatives, building on initiatives? Like how does that work?
So we are very data driven in what we do. We spend a lot of time using Excel to crunch numbers. We use lots and lots of lines of data and spreadsheets. So we're all very efficient users of Microsoft Excel to be able to, analyze tens of thousands and in some cases hundreds of thousands of rows of data to see kind of where we've been and then look at where we're going from here.
Wow, impressive. Well, Director, you weren't kidding when when you were bragging on Maria and her abilities. I mean, just the thought of like all those cells in a spreadsheet makes my mind explode just a little bit.
Yeah, I think what most people would consider spreadsheet pandemonium, Maria calls that just a walk in the park.
I do like numbers, so that's a good thing.
We're glad you do. I'm sure the Division of Fiscal Management has a lot of responsibilities, the budget included, but this must take a lot of preparation to be ready for this kind of process.
Yeah, so our budget prep actually begins many months before the budget is actually introduced. The budget is generally introduced in February, but about 8 months before that, the agency receives our guidance from the Office of Budget and Management, informing us what our parameters are with regard to our budget requests. So throughout the summer and the fall of the year prior to the budget's introduction, we're analyzing expenditures for the past 2 years. We're looking to the future in terms of what we want to accomplish. This involves program staff and fiscal staff, human resources, IT, and the agency leadership. So generally by November 1st, prior to the introduction of the budget, we've submitted our request to OBM. And so we've actually had to plan pretty far ahead. When you think about that, the budget won't even be adopted for another, almost 9 months. And then it lasts for 2 years. And so, we submit our request to OBM, and then over the next several months, they analyze it. They analyze what we've submitted, and they have discussions with each agency about what the future, will look like in the upcoming biennium in terms of resources, while they're projecting, revenues for the state. And so, those discussions will then inform the Office of Budget and Management to make their recommendations to the governor's office on what his budget package will look like when it's presented to the General Assembly. So the budget submission itself is a compilation of program narratives, historical financial reports, expenditures, revenue, staffing, and payroll projections. So putting together our budget submission for the Office of Budget and Management, it's really an all hands on deck endeavor for the agency.
Let's talk about how the budget invests in Ohioans with disabilities. Director, I wanted to hear from you. What is really the top priority with the proposed budget?
First and foremost, when we sit down to talk with the governor's staff, they say, okay, well, what are the priorities? What is it that you think is important? We say service to individuals with disabilities. That's first and foremost. Our policies, our legislation, our, things that we want to talk about. We always say, first and foremost, serving the individuals with disabilities. So as part of that, the governor signing that executive order right after he was, sworn into office 2 years ago, when making Ohio a disability inclusion state and model employer. That's kind of our North Star of what we're looking at. So if we're looking at legislation, we're looking at funding, we're looking at policies, we're looking at partnerships. That's what we are using along with our guiding principles as our guiding principles to move forward with what we want to do. So when you look at trying to engage more students, we're serving, I think outside of Texas, we're the number 2 state in serving youth under the age of 16. That's not an accident, that's deliberate. And that was started probably 7-8 years ago, not long after I was here, to really shift. I think the average age of engagement when I came in was like 17.5 years of age, meaning kids were in their senior year, which I don't want to say is too late to talk about what do you want to do, but I certainly think we could do a lot better. And so now we're engaging kids, by federal law, we can engage with them at 14, some of them even earlier with what's called pre-ETS or pre-employment training. And the earlier you intervene, I don't care if you're talking about substance use or education or anything, the earlier you can be involved with somebody to educate them on the options they have, the better off they're going to be. So we're doing that in the schools. We're also looking at higher education, partnering with our 15 public universities and colleges and community colleges. Obviously, the pandemic has put a little dent in those, but we're still moving along. We're still working with people. We have counselors at those locations. And then the specialty dockets, where we've partnered with the Supreme Court of Ohio, where we have counselors working in courts around Ohio, 7 of them, I think, to be exact. And that took a hit with the pandemic, but working with individuals with substance use disorders and being able to, get them on a path of employment once they're stable and have gone through their treatment. And, that's just an innovative way of trying to do this. And these were all things that were supported by the governor in the previous budget and have been reinforced with this budget.
It's great to see them be able to continue on with the proposed funding. That's wonderful. And included in that is the vocational apprentice program?
Yeah, the vocational apprentice program is something, it's probably not to the scale of the other two, and that's again, because I think by the time we were ready to roll that one out, we were all sent home. But that's to increase employment with our sister agencies. Now that things are starting to progress in that area, and we've actually had some work with agencies where the jobs that they're looking to fill are telework jobs. And so we've placed some individuals, I think we're up to close to 10 individuals so far through the vocational apprentice program, working at Aging and Office of Budget Management and a couple others. And so we're looking to expand that. We obviously want to be able to place somebody in that gets full-time employment. That's really what's supposed to be at the end of this rainbow. This is a way to take out the fear of some of the agencies and employers to say, wow, OOD's paying for their salary, plus the counselors working with them for the on-the-job supports. And then hopefully they're going into this knowing if this works out, we want to hire them full time. And if it doesn't work out, how do we find something else for that individual and get another candidate in there that might be able to do those types of job skills? So yes, that's a very important initiative. And thanks for reminding me, Kim.
Yeah, sure. Maria, I wondered if you could explain a little bit about how the proposed budget for OOD has an impact on local business communities.
Sure. So we spend funds in all 88 counties across the state because we serve individuals with disabilities in all 88 counties in Ohio. And so, we purchase a wide range of vocational rehabilitation services from approximately 300 providers across the state. They may provide services such as job skills, job development, job coaching. And so with the changes that we experienced with our job seekers due to the pandemic, providers have had to shift gears and minimize disruption in services by, adopting certain safety protocols and transitioning to this virtual environment we find ourselves in. These strategic investments in our providers will ensure that they can deliver the services that are needed to help individuals we serve get and keep jobs. And so over the next biennium, we anticipate spending approximately $74 million each year to purchase vocational rehabilitation services, primarily from local Ohio businesses. We believe that supporting these employers and providers will help strengthen Ohio's economy by adding to the recovery efforts.
I think sometimes people are surprised that the services that OOD offers through the Bureau of Vocational Rehabilitation relies on providers. They don't realize that it's not actually our counselors that do all of the hands-on, that the planning and employment goal setting starts with the counselor, and then that we rely on this entire network to get the services and supports that individuals need.
I think that when you look at the number of individuals that we serve in a year, nearly 30,000, and the number of counselors that we have, it would be nearly impossible for our counselors to be able to provide that direct service to each person on their caseload. And so, our counselors really coordinate services for the individual, help them plan their future, plan their career goals, and then they pick along with the counselor the providers that will actually help them develop the skills needed to be able to get those jobs that they want.
That makes sense. And Director, I know that you highly value informed choice when it comes to participants and selecting a provider.
Yeah, we've dedicated to make sure that we've worked with our providers to do scorecards so individuals can make their own determinations on, depending on their disability. They might say, well, who has a lot of experience in working with individuals like me? How long does it take? How successful are they? And that is important. And it's kind of the first commandment, so to speak, when it comes to vocational rehabilitation, which is the individual has the right to choose.
It's just tremendous that vocational rehabilitation does that for 30,000 Ohioans. I'm curious, the Division of Disability Determination, how many Ohioans are they able to serve each year?
Maria could tell you, most people don't realize we do all the Social Security claims that are filed here in Ohio. So we say OOD, we do a continuum of service. We obviously want to talk about employment as the first option, but we also know that sometimes that option is not viable for everybody. And that's where Social Security comes in. And in my 10 years that I've been here, it's usually depending on the economy and other factors that you've seen historically. But I've seen as high as over 200,000 individual claims being filed a year. We've also seen as low as about 150,000 being filed each year. Part of that is trying to debunk some of the myths like, oh, well, you got to apply 3 times, you're denied. That's not true. Our rate of approval that is done through the guidelines set by the Social Security Administration is about 33, 34%. Those are all first-time claims. So to those 33%, that's the very first time they've ever applied. So when they start talking about, oh, well, you got to keep filing, those are usually things when they appeal and it goes to the federal government that, there's outside of OOD people who could, like administrative law judges and things like that could be appealed to. When you look at what we're able to do, we certainly know there are individuals with disabilities where, employment is not an option because their disability is so severe. And so how we are able to educate folks in that is something we partner with Social Security Administration, also our counselors who work with individuals where employment's just not been able to be attained. We give that as an option for them to go through that process.
Thank you for explaining that. In terms of the actual numbers that the budget that's proposed represents, Maria, what are we looking at and kind of how does that compare to where we have been in the previous budget cycle?
So OOD's budget, this upcoming biennium that's under consideration right now, represents a state investment of about $19.4 million in general revenue funds in each year of the biennium. So when you look at general revenue funds that other agencies receive compared to OOD, we really only receive a very small amount, but we do a lot with it because of that generous federal match and the multiplier on that. And so this represents a continuation of our current funding level for state fiscal year 2021. So we are very fortunate to have continuation funding as part of the governor's recommendation.
Great. And Director, within this budget then, is it able to support anything new? I mean, I do realize it's a continuation, but anything new on the horizons that the budget supports?
Well, I think what's important to understand is there's going to be a lot of new things because we couldn't do them last year. So, people are like, well, are we going to hire? And it's like, well, with continuation, the things we couldn't hire from last year because of the pandemic, we will be able to do moving forward this year. So it's kind of interesting. We're saying we need continuation, but it'll look like expansion because we weren't able to do the things we wanted to do over the last 12 months because of the pandemic. So you'll see those expansions into the jobs for recovery specialty docket courts, expanding into some new counties, increasing our numbers for students at the public colleges and universities. We've got capacity, so we're looking at how do we maximize that capacity. We've got 10, 11, 12 state agencies that have hired somebody, but we want to get the additional 25 or so to also move into that direction and how we can make that happen. So those will look like expansions and new things that we're doing when we actually were planning on, hopefully this time, talking about how to expand on where we would have been last year, moving up to where that is. So I think we will constantly be looking at, I think sometimes what's important, and when we talk about the budget, I know a lot of people ask questions and a lot of, maybe this isn't the right word, but I'll use it, detractors say, well, you give money back, Director. There's all this money that is lapsed. And what they don't realize is I can't give back what I never had. We usually
meaning giving back
funds.
Federal dollars.
That's correct. The only money I get is based on the general revenue I receive, and then I'm able to draw down. So I think people think, for those who don't know, the federal government wants you to spend the money, but if you can't sustain spending that money, they penalize you. So we've always been very, and Maria can detail this a little bit more. What you don't want to do is spend without the ability of understanding that it has to be sustainable. So if you're not getting results from what you've expanded, you're in trouble. What we've done is people have said, oh, well, you could draw, up to $30 million more, which we could. But if I can't spend that next year and the year after and the year after, then you start to get penalized for not spending that. And they actually take money away from you. I say we're serving everybody who walks in the door. It's not like, so what is my story I would tell on why I need more of that money? That I could serve more people? Absolutely, we can. But we haven't reached the point to where that we need to get to that. We were growing in the last budget. We did ask for an increase and we got it. So this continuation, I feel like because we had the pandemic, we weren't able to kind of spread our wings to expand like we were hoping. And we were hoping to build on that to even go further, to get even closer to eating into that additional money. So I would say our staff know this. They're very well versed in this, and they know we want to be able to do more things and expand into new things, but you got to be able to show the results of that. And you don't want to expand to where you can't sustain. Am I correct, Maria?
Yes, I'd agree with that. And we've also tried to be very responsible in not taking funds. You know, we know a lot about ourselves. Director Miller's been here for a decade now, and we know that when we expand and bring new initiatives on, it takes a minute to get ourselves together and get ramped up. And so we don't want to say, give us the full amount for that right out of the box, when we know ourselves and know that it takes time to build those relationships, hire counselors, get them trained, build up their caseloads. And so we've tried to be responsible in what we've asked for and tried to only ask for that which we know we can spend in a year. And then we go back and ask for more. Mm-hmm. And so we've tried to take a very reasonable and metered approach to any expansion initiatives that we've had.
What does this mean in terms of the provider community?
We couldn't do this without the partnership of the providers. So our provider community, some 300 providers approximately across the state that we partner with and broker services with, serving individuals with disabilities. This pandemic, I think, has shown that our relationship with the provider community is strong. We've modified a lot of services. The providers have modified a lot of how they deliver services based on keeping those individuals with disabilities at the forefront. I think that shows, one, that we've had a good relationship, and two, how we're able to continue strengthening it, because we couldn't do this without them, and they couldn't do the things that they do without us. And so that the dollars that are represented in that is, $70+ million that goes out into that provider community to purchase services. Am I correct, Maria?
Yes, that's correct. We need them to do the work that we do without question. We try very hard to provide as much support for them as we can in terms of making our systems more efficient for their billings and their report writing and things like that. So we're always looking at ways that we can enhance our relationship with them, because it is very much a partnership between us and the providers.
What happens next in the budget process?
Well, it'll go before the full House that'll be voted on. We testified in the House Finance Committee. There hasn't been any indication that, when they questioned us, there were things that they didn't like. So we don't anticipate, knock on wood, any amendments or anything that would change what our funding level is. But that is their prerogative to do. Then the bill will be voted on by the full House, and then it'll go over to the Senate. So if you're familiar with just the bill, as Bill says, and then it starts all over again. It'll go into Senate Finance Committee. I will testify in front of the Senate Finance Committee, and we will be meeting with individual senators and representatives, like I have been doing, to discuss where we're at and why we're asking for a continuation. It'll go to the full Senate. It'll be voted on. So you always have two different versions. The House that's passed, the version that's passed by the House, and the version that's passed by the Senate. So there's always some differences. So what then occurs is something that's called conference committee. And that's a makeup of 3 senators, 3 representatives, and then the administration. So the governor and probably the OBM director. And it's because the House is in the majority, the Republicans, and in the Senate, there's 2 members that are Republican and 1 that's a Democrat, and the same on the Senate side, 2 Republican, 1 Democrat. So then they get together to try to hammer out those differences. And then by law, the governor has to sign, by our Ohio Constitution, a balanced budget by midnight of July 1. So it's like June 30th is we kind of celebrate the end of the fiscal year there, and that starts the state fiscal year July 1. And then that process will be in effect, and we'll have a budget for the next 2 years starting July 1.
Director, what do you hope listeners will remember from the discussion on the budget today?
That we're good stewards of the public dollar, and we don't compromise being good stewards in being aggressive in serving individuals with disabilities. We talk a lot about numbers, but those numbers are people, and we're not lost on that. We use numbers, though, to help tell a story, especially to a body like the General Assembly, who are looking at that. They have to look at dollars just like they're looking at what the services are. We don't sacrifice service, but we also make sure that people know that we're trying to do what's right, and we're trying to live within our means.
A transcript of today's episode is available at ood.ohio.gov/podcast. Don't forget to subscribe and leave a rating and review. We're on social media at Ohio OOD. Do you have a disability? Do you want a job? We can help. oodworks.com.